Okay, so guys, we're talking about I think this is a X-link hypophosphatemia is the same thing. You could say X-linked what phosphaturic rickets. You could also say X-linked what hypophosphatemia rickets. Now let me just give you a gist. If they say X-linked, you actually inherited it. Hypophosphatemia or hypophosphaturic, when you say uric, is what involvement of the renal system. So this one, the ability of the kidneys to reabsorb phosphate back into the body is impaired. So you are losing a lot of phosphate through urine. Do you understand? Losing a lot of phosphate through urine. So let's quickly run through it. So we say it's a genetic disorder characterized by what? Renal phosphate wasting. Okay, renal phosphate wasting. So it leads to what? Hypophosphatemia and defective bone mineralization. And this is due to what? You are losing phosphate through the urine. So we say X-linked is inherited. So now let's quickly look at the possible mutations. So mutation is the PHEX gene. Alright. So there's PHEX gene mutation. Now there's mutation in the PHEX gene. The PHEX gene usually regulates what? The fibroblast growth factor 23. So just get the rough gist like this. If fibroblast growth factor 23 levels are high in the body, phosphate will be leaving the body. Like phosphate is an enemy to what? Fibroblast growth factor. Just get the gist like that. So increased fibroblast growth factor activity leads to what? Reduced phosphate and reabsorption. So phosphate has to leave the body. This usually impairs what? 125 or dihydroxy vitamin D production. So X-linked dominance is usually affect what? Males. When you're talking about X-linked stuff, it's usually males, right? So such a person, there's low phosphate, okay? Of course, there's low calcium, so usually present with rickets too, right? So pathophysiology is renal wasting, so the kidney fails to reabsorb phosphate. This now leads to what? Phosphate levels going down. So bone mineralization is defective, so your bones are soft. This can lead to what? Rickets and osteomalacia. So your short stature, so your legs could actually go out or your legs could go in. See, this one's the legs actually not knees. This is actually going out. It depends, you understand. All of them have to do with the bone mineralization is low. So dental defects, you have some one or two problems on your teeth too. So biochemical findings is you see that phosphate levels are down, elevated alkaline phosphatase, normal or low what? 125 dihydroxy vitamin D. Okay, and of course the chief thing that is usually causing phosphate to actually leave the body is what? Fibroblast growth factor 23. So the levels will be shooting up. You understand? So treatment is use drugs like what? Barosumab. You give phosphate supplements because the person is lacking phosphate. They give calcitriol, which is what? The active vitamin D. The orthopedic intervention, of course. You want to now treat all those bone deformities that the person actually has. Okay, so that's just it for the X-linked phosphaturic rickets.